So if I had to characterize what week 2 was like in one word, it would be frustrating. At this point, you start to gain your energy back. You get a little bit tired of sitting around and not doing anything. I took an entire month off. Because that's what my surgeon told me to do. He told me take 4 weeks off. So I did exactly that. In week 2, my husband was taking over my piano students. So he would be gone for some days of the week for only a couple hours. But those couple of hours when he wasn't there, I felt like the world was falling apart. I couldn't do anything by myself. It's a little dramatic, but the first week he was taking care of all of the food for me. And everything was pretty watered down. So when I would syringe and eat it, I could eat it very easily. But now I was kind of learning how to do that for myself. A lot of the times the food was either too thick or too thin. And if it's too thick, it doesn't go through the splint that you have in. Not everybody gets a splint, but I did have one, which is kind of like a mouthpiece that stays there. You can't take it out or move it because you're wired shut with the splint in. So if you have like even a little bit of a chunk in your food, it will not go through. I read that everywhere, but I didn't believe it. I thought that I could somehow get it in, maybe behind my molars, or maybe I could like try to like suck it in through the splint, but it did not work. So when you do your liquid diet, don't even try to put chunks in it. Like even small chunks, it's just gonna get caught. It just makes it harder for you to clean when you are doing your oral hygiene process. So by week 2, I had 3 syringes. 2 of them had already started getting worn out. And what that just means is that you can't pull the handle as easily as when you first bought it. So either it would get really stuck and you have to pull it as hard as you can, which is, even my husband struggled with it. So me, like 100-pound me, with little energy, could not really do it. So, but when I did try it, it would just pop out really fast, and the food that was in there would go everywhere. And there were a couple of instances like that where it really made me angry, and the lifestyle had started getting a little tedious, and that's why I say that it's frustrating. I did see my surgeon that week. I had my surgery the week before on a Monday. I saw him 2 days later, the day after I was discharged, on Wednesday, and I saw him again on the Tuesday following. And he told me, my swelling got a little bit better than the week before. I mean, I looked crazy the week before. So he said it looked good. Yeah, so he told me that the splint would stay in for another 2 weeks. When he told me that, in that moment, I did not know what that meant. The splint wasn't bothering me as much at that point. But as the week went on, it really started to get on my nerves. And I think maybe my tongue started getting more active when I was trying to talk through my splint. So it would actually muddle my speech more. And my husband would have trouble understanding me, and I'm trying my best to talk. And the second week is just getting used to this lifestyle. So when I saw my surgeon, I had one complaint, which is that I was having pain here in my sinus, like a lot of tightness here, and then it would extend all the way to my ear. So when I would touch my ear very lightly like this, it would ache. And so I told him that, and he was like, oh, that's totally normal. Your sinuses are full of blood clots. That's why. And I had no idea. But at this point, I was still consistently getting, I don't know how to say this. It's just blood snot, blood mucus, whatever it is. It would just keep dripping down my throat. And it's really thick, so you can't really spit it out either, especially not with the splint in. So I'm always tasting blood in my mouth. Sometimes I would literally get a blood clot down from up here. But I definitely couldn't spit that out. The first time it happened, I put really warm water in my water pick machine and tried to break it down by trying to aim it through the little spaces in between my teeth. But that took around 20 to 25 minutes, and it was not worth it. So it didn't happen too many times after that, but if it did happen, I just ended up swallowing it. Not a great feeling, but it was more of a mental thing. So just don't think about it too much, because it'll make you sick. And that's the last thing you want when your mouth is wired shut. Oh, and by the way, my husband made sure that I was always walking around with wire cutters and what was the other one? Zofran. So always like one little packet of Zofran and wire cutters just in case anything happened. But I never had an issue with nausea, thank God. So since my doctor said that it's normal and there's nothing you can really do about it and you just have to wait it out, I read online that it helped some people to have either a steam humidifier or a face steamer. So this is the one I ended up getting at Target. It was like $20 something, maybe 30. But basically just steam comes out of here. And I would do that for about 20 minutes once a day. No, maybe twice a day. And it felt good, but it didn't give me any lasting relief. It was more of a momentary thing. It did feel very good here. It almost felt like it was relaxing a little bit, but I think honestly, the sinus pressure, you just have to wait it out. So what was so frustrating about week 2 is getting used to this new lifestyle as a sane being now, because you're much better at this point. You have more energy, you have more of an appetite. So you're craving to, want to do more or eat more stuff, have more variety in your diet. You kind of have to suppress it, which was very hard. And 2, it's the blood mucus, drips day and night, especially at nighttime. It kind of feels like post-nasal drip. And when it goes down your throat, you want to cough, right? That happened a lot. when I'm trying to sleep. And I did sleep upright the entire second week, but that didn't, I don't know if that helped, but maybe I would have experienced it more, but I still had to wake up to cough and spit out blood. And then, of course, there's the sinus pressure. Of course, there's the sinus pressure. That was very uncomfortable as well. So there's week 2. For week 3, I would say the best way to describe it is acceptance. I started getting more into the groove of, when to eat, how to make my food. I stopped craving variety, which is good because I would just make a big batch of Japanese curry, and I would eat it for breakfast, lunch, and dinner. And it blends up really well. So if it's very different from Indian curry. I think, at least I have this association with Indian food, that it can be a little bit rough on your digestion. And maybe that's not true, but like Japanese curry is very gentle. It blends really well, very high in calories. So I just ate that all the time, aside from milkshakes. That's how I was able to maintain my weight at 100 pounds. So week 3, I'm trying to remember. I think I was regularly still taking walks every day, which is extremely important. Your swelling will go down a lot if you do that. Not saying that it won't swell up again, but at least for that day, it will go down. When you wake up the next morning, it might be swollen again, but go on a walk again. And then little by little, it won't swell as much the next time, which I should really practice what I preach, because I haven't been taking a walk at all these days, and I'm complaining about my swelling. But anyways, my cravings were down, which is good. I was getting used to the lifestyle. And then I was really looking forward to that weekend because I went to a friend's engagement party, and I drank. I actually started drinking maybe in the middle of week 2 because I stopped taking meds during week 2. And then 2 days after that, I drank this pear wine, which honestly, the taste was very weird. I really like wine. I like beer. I like cocktails. But the second week when I was drinking, it tasted a little strange, which is a common thing. I don't know if it has to do with your mouth being shut. I don't know why, but it will kind of taste the way that it used to taste when you didn't like alcohol. But I just wanted to get a little tipsy, because I had nothing else to do other than, being home and trying to recover. So by week 3, and by that party, I was able to enjoy alcohol normally. It tasted good. I drank quite a bit, and I would say I was drunk, but I was in such high spirits that I had a great time. It was nice to kind of get out of the house, and I think it was very nice for my husband too. We just, talked to a few different people. For me, it was mostly listening, but it was fun. And I think it's really important that you see people whether it's your family, your friends, or just going out and going to a coffee shop. Just kind of be in a more stimulating environment. I feel like it was good for my mind. And it kind of reminded me of what real life is like. But I think also I was excited because it was a Saturday, and I knew that in about 3 to 4 days I was going to get my splint out. So it was kind of like I'm seeing the light at the end of the tunnel kind of situation. So week 3, quite uneventful. I was less frustrated and I got into the grooves of things. So overall, I would say that week 3 is where things start to look up. So before the engagement party that I went to, I actually played my first gig ever since the surgery. I'm a violinist, so I play gigs, I play weddings, I play concerts, I teach, and that's my job. So I finally played this gig, but, playing violin involves putting the violin under your chin. So it still felt very weird. I tried practicing earlier that day without really touching this area, touching the jaw area. But it felt very strange because it was numb, it was swollen, especially, it still is, but this area is so swollen. So it felt different from how I played before. So it wasn't the most comfortable thing. And what I'll mention is that in the next appointment that I saw my surgeon, I asked him when I can play. And he said, he was like, oh, I wouldn't play for a little bit longer. So I was like, oh, great. Like, I did something I shouldn't have done. Now, I'm going to go back on track, and we're going to be talking about week 4 now. So as I'm talking about this, I am confusing myself with the weeks. What I consider week 1, week 2, is from the surgery day to the next Monday. That's considered week 1. And then week 2 starts the day after. So week 2 going to the next Monday, week 3 going to the next Monday. So yeah, that makes sense. I got my splint out. So what that means is that I got my splint out 3 weeks after my surgery. So I got the splint out, they cut my wires off, and then I got the splint out, which was a very freeing feeling, I must say. It was kind of odd to give you what the experience is like. He cut the wires off, and then he told me to open my mouth as wide as I can. It was hard. It was a very strange feeling because in your mind, you are opening it, but your muscles don't do the work for you. So there's like a disconnect here. So I can't even feel how much it's open, but I'm just sending the signal to open my mouth like I had before, but I could tell that my mouth wasn't opening because my surgeon was like holding my splint and he was trying to pull it out, but it just wouldn't come out. And I just remember being like, why isn't my mouth opening? And then eventually I like kept trying, and then he was able to pull it out. It didn't come out very smoothly. It kind of forced me to open my mouth wider than I'm comfortable. So it hurt just a little bit. It's nothing to be scared about. And he said that it would feel like your jaw is about to fall off, but it didn't feel like that for me. I guess I felt like the stiffness of my jaw when that happened. And but I was really happy because now I could see my teeth. Because before, my teeth were covered up by the splint. Or not even my teeth. I could see my bite. And I could see that my front teeth were in front of my lower teeth. And that was a crazy feeling. And then he was like, oh, do you want to brush your teeth? So they gave me a toothbrush, and I was able to brush off some junk that was stuck on my teeth because of the splint. But what was crazy was that I was not able to get the toothbrush like inside my mouth, because that's where I really wanted to brush. Because I could start to feel that there were things getting caked onto it, and it was really disgusting. But then he got me into these bands. So I'm not quite sure what the purpose of these bands are, but he said that it's basically like physical therapy for my jaw muscles. And he gave me extra bands. They're very small. They're this small. It's like smaller than one of those small hair ties, but he gave me that, and then like a little, it looked like a tweezer contraption that you can use it to hook onto your hooks, your braces. I didn't use it because my bands never snapped. He told me to not take them off for that week. And that week it was Thanksgiving, and my husband and I went to a family gathering in Hocking Hills, Ohio, where we rented this big lodge cabin and a huge Thanksgiving dinner, had drinks, we went in the hot tub, we had a bonfire. Great time. I had a great time. That again, I thought was very good for me, just to kind of get out of my house and, have a life. I was still pretty swollen at this point. So right when I walked out of my surgeon's office, my jaw felt like it was a dog in skates. I don't know what contributed to that. I think it's also because my molars aren't quite matching in the back. I don't know, because I can't really see it, but it feels like it doesn't match. And so I felt like I was trying to put it into the right position constantly. And then I started getting stressed out because whenever I would rest it, I would think, but what if that's not the right position? And then what if my jaw moves out of place? It was very uncomfortable and nerve-wracking for the first day that I had my splint out and the wires cut. But come to think of it, I really shouldn't have freaked out. Like, it was going to be fine. And then, by the time I knew it, my jaw had settled and I no longer struggled with that. And by the way, for Thanksgiving, if you do the surgery near the time of Thanksgiving, just know that blending up your Thanksgiving food is actually really good. I blended up green bean casserole, turkey, mashed potatoes, gravy, and a little bit of beef broth. And we sat at this big fancy table, and I was eating out of my syringe. It was a very funny picture. But yeah, and then we had leftovers, so I would just eat the same. I would make the same soup, and sometimes I would mix the sweet potato casserole with oat milk, which is also very delicious. I mean, it might sound disgusting, but I was very bummed out that I wouldn't be able to enjoy Thanksgiving, but I think everything turned out better than I expected. So after the family gathering, my husband and I drove back home, and then I drove an hour to go play at another wedding. This one was a little bit longer. It was about 2 hours and a half. And it was a little bit too long for my comfort. And because like I said, everything was just so different. It wouldn't sit under my jaw very well. I thought that I could try to play it without keeping my jaw down, but it doesn't work, because part of holding the violin down is this motion, which is gently keeping the violin under your jaw. So it was a very uncomfortable 2 hours and 30 minutes. And I was like, I am going back to work full force once I hit the 1 month mark. So I had to figure something out. So I ended up buying this strap that I can put around my arm here. It goes around my neck, and then you tie it onto your violin, and it basically floats. So I don't have to worry about keeping my jaw down, so that my violin doesn't fall. Another thing I forgot to mention is that my end of week 2 appointment, my surgeon was actually pretty surprised that I was still pretty swollen. So that's one thing I wanted to mention. But then when I went to the appointment the week after, he was like, oh, your swelling went down a lot. So once I hit the 1 month mark, that's when my doctor told me that I can start soft chew diet. And I was dreaming of this day. But that night I went to the Cheesecake Factory with my husband to celebrate, and I got a salmon, which is, very flaky. It falls apart very easily. And right when I was about to take my first bite, it wouldn't quite go into my mouth, because I could open maybe like a year wide. And the fork was like really thick for some reason. So I would like hit the fork everywhere on my teeth before I could actually get the salmon in between my teeth. And it got to a point where it was too hard, so I started using my fingers. I would like grab a little flake of the salmon and just kind of fit it into the gap. And chewing is going to be super weird when you first do it, because the food will land on your tongue, but then you don't know how to get it to the sides to chew on it. So I ate half of the salmon only. It was also rice and like some other stuff. It took me about 45 minutes to eat half of it. It was a lot of work. I was very tired. I was very bummed that it was not the outcome that I was hoping for. But my husband was like, it's gonna take some time to get used to it. So, calm down. Surely enough, within like 4 or 5 days, I started to get a little bit more used to it. But I will say that I don't know if it's my braces or if it's just my teeth or my gums getting sore from the chewing, because they've been so out of commission. But my teeth would get very sore. Or I guess it's not my teeth, it's my gums. So it really discouraged me from chewing, which is not good, because I think that's part of the exercise of getting your muscles going again. But also because I'm working full force and it's the holiday season, I don't really have the time to sit down and eat for 45 minutes. So a lot of the times I would make foods that are easy to blend up, not to the point where they're pureed, but just like chunky, but still has some substance to it. I would do that and just kind of like swallow the food. because a lot of times I just need to eat and go. So I don't know how negatively that's going to affect me. I I might need to try and chew a little bit more diligently, but I will when I have the time. And hopefully that will be enough to kind of train my muscles to start chewing again. This past Monday, it was week 5. My surgeon told me that I'm free to take my bands out and stretch my mouth. My question to him was, do you think I need to get physical therapy for my jaw? And what he said is you would benefit more from a face massage rather than physical therapy. And there's not much you can do aside from stretching your mouth and chewing. So, I mean, I'm just going to take his word for it. I know a lot of people go to different kind of therapies. Maybe in the future, I'll consider it if I have a lot of trouble. One of the good things that he said in my recent appointment is that my jaw definition, my chin definition is coming out a little bit more now. And we are both glad that I did not get the genio done during the surgery. And I'm surprised he knew the cultural differences, but I think Asian culture, the chin is not necessarily super prominent. I don't think it matches the Asian standard. Not that I want to look standard, but it looks more symmetrically pleasing, I think. So I think I mentioned this in the previous video, but he was going to decide if he was going to do the genio or not in the surgery, and then he decided against it. And then later on he told me, if you want to do it, like a year from now, once your swelling is completely away and you can see your profile, I'm free to do it then. And I could just do it in his office. And, it's not like a whole big deal of going to the hospital or anything. But it seems like I'm not going to need it. He said that there's just a little bit of swelling left right here. And usually, this part dips a little bit more, but it's a little bit straight still. So hopefully that's how I feel once my swelling goes down, because I really don't want to do any surgeries anymore. Okay, so now we're in the midst of week 5. Next Monday, I will see my doctor again, and that'll be the last time in a while, I think. I don't know when the next time I'll see him will be, but he's basically going to pass me off to my orthodontist, which I'll be seeing on Wednesday. And I'm very excited for that because I really want to get my molars to match. I can feel the corners of my molars. Like, if this is how molars are supposed to be, it feels like my molars are going like this rather than this. So it would be nice to just get that straightened out. I think it will help with my speech a little bit more. Right now, for the sake of the video, I am talking very clearly. I hope that it is clear. But when I'm just talking to my friends, a lot of them have trouble understanding me. Because by nature, I'm a mumbler. And so on top of that, I have all this swelling going on, and it doesn't help. So it's been a month and Monday, Tuesday, Wednesday, Thursday, Friday. A month and 4 days. And I think it's been about a week and a half since I posted my last video. I think I can smile a little bit wider. Not that that's my natural smile, but this is what it looks like. And I do have my bands on, and I don't want to take them off because it's a lot of work to put it back on. But I'm gonna try to open as wide as I can. Oh wow. Okay. So a couple days ago, it was like I could almost. It was a little bit. Yeah, a couple days ago, I could like fit my one finger in almost. But I can do it pretty easily now. Before the surgery, I tested this out. I was able to fit 3 fingers in. So, yeah, I have a long way to go. But it's been a lot easier to eat. No, taking my bands off too. So, ever since he said I can take the bands off, life has been much easier. I do forget to put them back in a lot of the time, so I need to be better about that. And also, I realized this yesterday, but I still have a little bit of bruising right here and right here. Wait. Yeah. It's not as noticeable, but it's definitely there. So hopefully that clears up soon. Nothing a little makeup can't cover up. I did use Arnica gel. I don't think it helped. Oh, and one more thing I forgot to talk about is going into week 3. So week 3 to the week 4 mark, I had a lot of problems with tension headaches because I was still sleeping upright. Wherever I'm sleeping, I cannot keep my head up. So I end up sleeping like this. And so that strains a lot of my neck muscles or my trapezoid muscles here. So I had terrible tension headaches. And so I whipped out my liquid Tylenol again for the sake of my headache. Lots of tension headaches. It was very uncomfortable. I did go to get a deep tissue massage, which I was cleared to do probably around like day 20 or 21, something like that. He just told me to make sure to lay facing up and don't lay facing down, which I wouldn't have done anyways because that would have been very uncomfortable. And going into week 4, I started sleeping just completely flat because it did make my face swell more in the morning, but the quality of sleep was much better, and I was willing to sacrifice a little swelling for better sleep. So I decided to start sleeping completely flat. Everything I said may not apply to you. Everybody's a little bit different. Like especially with the weight thing. Especially with the weight aspect. I only lost 5 pounds. I was 105 before, so now I'm 100. Some people that I see in the jaw surgery group on Facebook, they lose 20-30 pounds. So I don't know. I mean, thank God I didn't lose 20-30 pounds, because I would be like a skeleton. But everybody has different experiences. I keep forgetting to talk about a lot of things. I also have numbness right here. So my lip here, and then like this whole area is numb. I feel like maybe this is coming back just a little bit. When I do this, my nerves go crazy. It feels terrible. I mean, terrible and funny at the same time, but Hopefully my nerves regenerate and they come back. I really hope so. I would say that the blood mucus still happens from time to time. I have to clear it out, obviously in the morning and at night, maybe once or twice throughout the day. Right now I am feeling a little clogged up here. I'm gonna wait until I'm done recording to get rid of that. I also started taking vitamins regularly from middle of week 3. And before I got my splint out, what I would do is I would blend it up with applesauce and just try to syringe it. Which, you know, it didn't taste delicious, but I don't hate medicine too much, like taste of it. So I was able to bear it. But, yeah, I just tried everything I can to I tried everything I can to give my body the nutrients that it needs in hopes to try to recover faster. Yeah, overall, that's just, that's how my life was these past 4 weeks, I guess. I'm really looking forward to going to the orthodontist. Well, that's an overstatement because every time they change my wires, it really hurts. So we'll see how that goes. And then one more side note, saying an S is very strange to me. Sometimes it'll sound good, and then sometimes I sound like I have a very thick lisp. And my husband was trying to teach me where your tongue rests when you say an S, but I can't quite get my tongue to do what it's supposed to. Like, it keeps trying to go all the way to the edge to say an S. Oh my gosh. Quite a bit of a gap here. Oh well. That's part of the experience. I'm just kind of learning this new way to talk. In my very first video that I posted, I explained that when I say an S, every time I say an S word, I would drag my lip this way and go like that. And the fact that I'm not doing that anymore, I don't think is insane. It's also very hard to move my lips evenly because this part's numb. But I'm trying to be cognizant of having symmetrical mouth movements. So maybe that'll help my speech. But anyways, I'm gonna stop here before I talk for too long. Thanks again for tuning in. I will do a video about what I bought in preparation for the surgery, what I'm glad I had, what I didn't need, and what I wish I had. So if that's something that interests you, please feel free to come back and check out the video. And I hope you found this one helpful and not too rambly and boring. So thank you.